Well, that brings us to focus on certain key aspects in the country. Having lost those very, very key personalities in the country, in the football world. Well, medicine, sports medicine. Joining us now to talk about healthcare and some of the associated matters on this matter is Dr. Babatunde Akodu, who is an emergency medicine expert. Thank you for coming up this morning.
Yeah, good morning. Thank you very much. Welcome to the program.
Well, this also makes us, wonder and ask a lot of questions. And perhaps if this is what will make the authorities do the necessary things, all well and good. But looking at how this has played out, emergency care comes into question. But you get to hear at this point in time where people ask basic questions, they wonder, whatever happens to emergency trauma and trauma care? But first, I have people who will ask you, do we really have emergency medicine in this country?
Really, there is no structured emergency medicine program in the country, but there are courses, short courses available, outside the country. People can learn and then have a hands-on experience on emergency care, both trauma and then medical emergencies. And they are usually available. I had the training in US, in Stanford, about 2 months program on emergency medicine, and I'm also I had ATLS training in US on trauma, emergency, then an ACLS course in US on heart attacks, related problems, then some pediatric advanced life support. So basically, there's no structured program in Nigeria, but there are scattered courses internationally that one can get registered, and then you get acquainted with the management of emergencies in any hospital.
Well, but of course, there appears to be a huge gap in this country in terms of what we need to do to get to maybe a basic point. What have you seen?
There's a lot of gap. Most people are just basically trained as doctors.
General practitioners?
General practitioners, Even the people that are specialized in maybe other specialties, maybe trauma or even physicians, there's a whole concept of emergency care that is different from the usual trauma or physician training you've had. There are some concepts that are only they are made for emergency care. For example, ABC of resuscitation. It's not part of the routine specialist training in other disciplines. But as a course, defibrillation, CPR, these are concepts that are grouped together as a course in emergency medicine, which is not found in other specialty areas.
Is this such that, we've seen in other areas, they release very short documentaries trying to educate the populace in terms of emergency care, how to even give the CPR in an emergency situation. If there's an accident on the road, you should be able to perform some of those quick ones. But here, it's strange.
It's really strange. In fact, it's not available. Most people, even the public, is not aware of when somebody collapses, what's the first thing you do. Most people don't know. They just start shouting, run escalator. So the first thing to do is to make sure the person is laid flat, make sure the environment is safe. But those skills are not just there because there's no formal training. So what the government should do, federal and state, is to increase public enlightenment. An average American knows how to do a CPR, and he's not a doctor. So what the public should get is public campaigns on how if somebody collapses, what the first thing you do, and how do you call for help. Then there has to be. Then the government also has a role to play. Has to make sure there are defibrillation. Defibrillators are what you use to, when there's a cardiac arrest, like shock the patient. They should be available in most common points, like in most sports centers, maybe stadium. You should have such devices so that if somebody collapses.
I think that's one big aspect you've just raised.
Yeah.
We hardly find them around places, except you go to government areas where you have maybe the governors, ministers. That's where you find defibrillators. But in places like public places, we hardly find one around. Perhaps let's ask further how easy it is to acquire such and put in place for us as a people.
Well, it's very cheap. I'm very sure. I think it's because of most people are not. There's no awareness. People don't know. It's very cheap. In my emergency, I work in Luth Emergency. We have 2 defibrillators. We have 2 ECGs. But even some people don't know how to use them. So you have to train them. So, and this is a big problem. When somebody doesn't know how to use a device, then it's likely to run away from being, put into play. So what is very cheap. There are automated ones that are less than even 100,000 naira. Automated ones, and there are manual ones that even cheaper than that. So the main problem is that I think the government should also enforce private hospitals. So it shouldn't be just government hospitals that we procure all those devices. Private hospitals should also, because they also see emergencies, so they must also have defibrillators, and ECGs, very important, because you need to first of all do an ECG to get the rhythm of the heart, then determine whether it's a shockable rhythm or not before you shock. So the knowledge, skill is important, as well as all private hospitals or government hospitals must have these devices.
But have groups and practitioners, like yourself,
Okay.
made cases for us? Because, everybody knows that, look, there really is a lot of reason, there are lots of reasons why emergency health care in this country should be far beyond where it is now. Have you had such calls to perhaps champion certain reasons or causes or programs to say, look, we need to pay attention to this much more than we have?
Well, truly, there's a program that is coming up now by the National Postgraduate Medical College to start emergency medicine in Nigeria. And I'm also aware, because I'm one of the coordinators of West African Postgraduate Medical College for Diploma in Emergency Medicine. So I'm aware there's some groups coming up to champion its cause. Having said this, I think the bulk lies on individuals. So all hospitals should have training centers for emergency care. I think that's the basic thing. Like in Luth, we have such trainings that go on routinely, training doctors, training nurses on basic life support, use of defibrillators, use of ECGs. So, but it's also, the drive should also be individualized, because you need to have an interest in emergency.
When you say individuals, who? Practitioners or normal citizens?
No, practitioners now.
Oh.
So what normal citizens need to know is just the basic life support. That is, somebody slumps, you know what to do. Once you have secured that the environment is safe, then do a CPR. Then call an ambulance, who will bring the AED, the defibrillator. But I've been to some countries outside the country where they have AEDs, defibrillators stationed in most, like marketplaces, cinemas, where people gather, because such places can have some catastrophes from people suffering from heart attacks.
When you talk about people suffering from heart attacks, perhaps even though we have some other experts who will be looking at that, especially as regards sportsmen and women,
okay.
What symptoms do people really, because if you look at some other people before we ultimately lose them,
okay.
They have complained of one form of discomfort or the other, but sometimes it will seem as if they got an okay from their doctors.
Well, heart attack simply is a serious emergency due to a blockage of blood flow to the heart itself. The heart normally pumps blood for the rest of the body. Now, it also takes some part of this blood for its own mechanical means, So when there's a blockage to blood flow to the heart, it causes heart attack. And it's usually due to cholesterol plaques, accumulation of cholesterol plaques or blood clots in the coronary arteries. So once there's a blockage due to this disease, blood clots or plaques, cholesterol plaques, fatty plaques, then it causes heart attack. And the simple symptoms are very simple, and it's very easy to recognize, even by a layman. Most often times people have chest pain, central chest pain. And it will last for maybe more than 10-15 minutes. So we have a chest pain lasting for more than 10-15 minutes with some sweating. You see sweaty, especially following an exertional activity. Following an activity, you have a chest pain, you're sweaty, the chest pain radiates, spreads to your arm, your neck, your jaw, your back, then you suspect it. Some people have palpitations, being aware of heartbeat, some people, you know, feeling nausea, vomiting. Some people also have abdominal pain. I've seen one case of abdominal pain like that in my hospital. Patient presented with abdominal pain, but it was diaphoretic, it was sweaty. So I did an ECG and found it was an inferior MI. So such abdominal pains, it can be mistaken for an acute abdomen, and you go and operate. The patient dies on the table. So these are symptoms that are so, you know, it's so simple, but you need to recognize it.